This is another OSPE on osteology. Identify the bone and determine its site. So the answer you're seeing is temporal bone. This is a temporal bone. How do you identify the site? Look here, the temporal bone has different parts. This one is a squamous portion, thinned out portion. Then it has this zygomatic process. This is zygomatic process of the temporal bone. It is arising from the outer surface and it is directed forwards. It will fuse with the, it will join with the zygomatic bone to form the zygomatico-temporal arch. That's also called zygomatic arch. And there you find is this inside of the cranium. This is the petrous temporal bone, and this petrous temporal bone on its posterior surface here you find is the internal auditory meatus, right? And this below is the styloid process. This is styloid process, or it's a derivative of second branchial arch, and there are 3 muscles attached to it, 2 ligaments attached to it. Then about this petrous temporal bone, there is this anterior surface called tegmen tympani. This also forming the roof of the middle ear and internal ear, tegmen tympani. Then you have this on outer surface is this external acoustic meatus, right? An external acoustic meatus posterior-inferiorly also, and antero-inferiorly, it also has a thinned out plate, and that is called tympanic plate. Then posteriorly it also has a process that is called mastoid process behind to this external auditory meatus. So all these and mastoid process appears by the age of 2nd year of life. So all these features of a temporal bone you got to know, and the side determination is clear that this is directed inside the petrous temporal, outside is the zygomatic, and downwards is the styloid process, and squamous portion is directed upside. So that means this is of left side.